Welcome to Lifestyle with D, where we educate you matters health and where we encourage you to take care of your body because it's the only place where you live. Now, today we'll be talking about a topic that is not commonly talked about in the country, that is Cytomegalovirus, CMV. And we'll be talking to a mother who has been affected by this. Her twins are affected by this virus. And Joyce Wacheke, thank you so much for joining us today.
Thank you.
And we are so eager to learn about CMV because I believe it's something that's not very, well, it is common from what I've read, but not many people know about it.
Yes.
And of course, we'd want to inform mothers and potential mothers about it so that they can take caution.
Yes.
Now, before we start about CMV, probably you can tell us what CMV exactly is, the cytomegalovirus. It's a word that is very hard to pronounce.
Cytomegalovirus.
Yeah.
The short name, I think we can just use CMV.
Yes.
CMV is a very common virus in the population. I think since my sons were affected by it, I've been reading quite a lot, and my doctors also have been kind to just educate me on the same.
Yes.
It's a common virus in the population, affects, anyone can get affected, and it's passed through body fluids, sweat, blood, saliva, mucus, and semen, all those body fluids, it can pass through that. And once you're exposed rather to the virus, you may experience symptoms or you may not. If your immunity is strong, you will not experience any symptoms, but it will stay in your body until such a time that your immunity is suppressed, maybe because you are sick, you've received an organ donation, you've received blood donation, you're pregnant, you have HIV. That's when the virus now will start attacking your body. And also, if you are pregnant, if you fall pregnant,
Yes.
the body's immunity goes down so that the unborn child is not attacked by your own body. So by the fact that the immunity goes down means that the virus also now can become active in your body at that time, and can pass from the mother to the baby through the placenta. Yeah.
So this virus can affect anybody, any mother, rather,
It affects even men.
even men.
Even men, yeah. But it's really most dangerous for pregnant women because of low immunity, and so they pass it to the unborn baby, and it really affects the unborn babies. A pregnant woman may not even experience any symptoms,
Yeah.
or if they do, they could get flu-like symptoms like a sore throat, a bit of fever, but it will be treated symptomatically. They'll be given some medication for the fever, for the sore throat, and that's it. But the virus passes to the unborn baby, and so the child is born with so many complications, ranging from mental retardation to blindness to deafness, and such.
All right. Let's talk about your twins.
Yeah.
I know it's a very sad situation for you. But how did you come to discover that they actually had contained the virus?
Okay, my sons, when I gave birth to them in 2014, they looked okay. They just looked like normal boys. I didn't know the journey ahead of us. They were born with good weights, and then 2 weeks later, after we were discharged from hospital, we were back to hospital because of fevers, and that was the beginning of our journey with CMV. We don't know at what point they contracted the virus because they were not tested at even any time close to even the time that we were getting admitted. They were not tested for a whole year, so we don't know whether it was in pregnancy or immediately after birth. We don't know, but even at that time when they were getting fevers, we didn't know what was wrong with them. And we continued to have them on fever medication for a long time, and we've been in and out of hospital. We've been admitted about 6 times with them. And okay, then what happened is that initially, apart from the fevers, they were not doing well in terms of milestones. When the child is supposed to support their neck, they were not doing it. They were very weak. Their muscle tone was very poor. They were very, if you held them like this, you'd feel like they are very jelly in your arms. So we knew there was something wrong with them, but we could not really tell what it was. And our pediatrician at that moment did also not know. He actually kept telling me that it's because they are twins, and they have shared nutrients, calcium and all that. But eventually we had to change the pediatrician just to seek a second opinion.
Of course.
Yeah, the second pediatrician put them on supplements, calcium, there was also a minogard for just improving the muscle tone. So they were getting strength also in terms of supporting their immunity because of the infections that were happening many times. But still we had unanswered questions. We didn't know why they were like that.
Yeah.
Until sometimes last year, when they were about 1 year, not yet sitting, and we changed pediatrician again.
Yeah.
And now that one is the one who insisted we start physiotherapy on them. And also he said he must find out what was wrong with them. So he did various tests for growth hormone, HIV, and torches. He called them torches screening.
Okay.
Yeah, torches are infections that women get when they are pregnant that affect the unborn babies, and CMV is just one of them. That's an acronym.
Yeah.
And now, so he said our sons had exposure to CMV.
Okay.
Yeah.
Wow. So that's after the third pediatrician.
Yeah, and that's when they were 1 year. So by then he could not put them on any medication for it.
Yeah.
Or any treatment. He just told us we have to deal with the effects that it did on their bodies.
Yeah.
Like now he told us we have to be prepared for constant hospitalization because their immunity had been really affected. And then he said that we were going to have to do therapy so that they were able to sit and walk eventually. Yeah, and then we also had noticed by then that they were not responding to sounds. So we were also asking questions. Is it that they could have been affected their hearing? Because that's one of the things that CMV does. It causes hearing loss.
Wow.
Yeah, so he sent us for those tests also.
Okay. That means most doctors as well, they are not aware, or they don't bother. Can we say they don't bother to check or to test for this because it's not common?
Yeah, I would say they are not very keen. Most of them are not keen to test for those things.
Yeah.
Maybe it's just they are not accustomed maybe to finding it so much.
Yes.
So maybe a doctor who will do that, it's because who will test, is one who's seen many cases, and so when they look at it, they want, or even a curious doctor will want to know exactly what is wrong with our child. Yeah, that's a doctor who will find out more maybe about what's affecting your child, and they'll find CMV. Yeah.
Wow. And it's very sad to know that actually the symptoms are rare, and so you would not be quick to find out. So now what next for you, for the babies? Yeah.
Okay, right now the story didn't even end there.
Yeah.
I mean, later on, my son, one of them, we came to know he was experiencing heart failure due to a weakened heart muscle. They call it dilated cardiomyopathy. And that time he had it with also bronchopneumonia. So he was in ICU, life support for like a week, Yeah, but he came out of it, and now he's on medication for that.
That's one of them.
Yeah, the other one was not affected in that manner. Yeah. And now, right now, they are 2 years, 3 months. They are still going through physiotherapy so they can walk. They're not yet walking, but they can sit and they can stand with support. Not without support, but with support. Yeah, and what we are also doing now, we are trying to do an intervention for them for hearing because they lost hearing completely. Yes. Yeah, so we want to see how we can help them with cochlear implants. That's what has been recommended for us. Okay. Yeah.
So now, you as a mother, how is this affecting you? Because you've had your first child, and now this is your second birth. How is it affecting you as a mother now to see this happening to your kids?
It's been a heartbreaking journey because you look at your child, especially when my son was in ICU, and I was holding him when he just could not breathe, Yeah. And you just ask so many questions. You ask why. I mean, couldn't it have been prevented? Yes. Yeah, why your kids? Why do they have to go through that? You see other parents getting kids after you, and their children walk before yours.
Yeah.
Yeah, and so they ask you so many questions. So, what's wrong with your kids? They're still not walking, And some people blame you. They tell you, oh, you are too clingy with your children. That's why they can't walk, Yeah. It's been really a tough journey, especially because of the things that people say. Yeah, very hurtful things.
But you've done your research on this virus, I can imagine, because of what has happened. Yeah. And you've seen other parents who have gone through that and have survived. Yeah. Because I believe there are stories that some kids have survived this.
Yeah, one of the things that happened is that after I was told by the doctor that my children were exposed, he told me to read about it. So I just kept reading, and I went to Facebook. I searched for a group that deals with CMV, and there was this page called Stop CMV. and now I liked it. And they used to bring stories of parents who have gone through it and how their kids have been affected. And looking at some of these children, the way they were mentally retarded, some of them have breathing problems, they have to stay on oxygen throughout, they are feeding through tubes, they have cerebral palsy because of the exposure to CMV. I felt strengthened. I thought, wow, I have a lot to be grateful for.
Yes.
My sons are not doing that badly. So I was able to gather strength. I said, let me turn this pain and the disappointment that I'm feeling into an awareness, so that another child does not have to go through this, or another family, because eventually I had to stop working. It's really affected our family.
Yes.
Yeah, so I just don't want it to go out there, as in I don't want a child to go through this when I have this information.
True.
Yeah.
Okay, now you mentioned a mother can pass it through, sharing a spoon or even kissing them on the mouth.
Yeah.
Could you kindly explain more on how they can get it? Yeah.
For pregnant women, it's very careful. It's good to be very careful when you're pregnant. You want to protect your unborn child. If you have other kids, maybe especially from the age of 1 to 3 years, they are prone to flus. And some of these flus are caused by CMV. You would not know because you not test. Your child has already been born. They have an immunity, so they will not go the other symptoms way of getting so affected. They may just express a cold or a flu. So it's important to avoid sharing cups and spoons with your baby, or eating their remains, or eating from the same plate with them. Yeah, let your child have their food, and then don't kiss them on their cheeks. You can kiss them on the head and you can hug your child, but that sharing of milk, of straws, of cups, and being so kissing them all over endangers your baby. Yeah, so even for someone who is working in a daycare, or someone who is working in a kindergarten, and you're touching children's toys, you're wiping their noses, you're changing diapers, wash your hands every now and then with soap thoroughly, and just avoid too much contact when it's possible with those kids. Yeah.
Can the kids can they pass it to each other?
Yes, they do.
They do.
Yeah, but because their immunity is okay, their bodies are able to fight the viruses. Yeah, not unless such a time happens, maybe in future when they're immunosuppressed, maybe when they get pregnant. You can get it as an infant, and when you're pregnant, it's activated again.
So
and
the virus lives in your body forever.
Forever. Yeah.
There's no cure.
There's no cure, no.
But you can prevent.
Yeah, but they have treatment that can manage the symptoms, just to manage it. Yeah.
Yeah.
Yeah. When maybe a baby is just born and it's doing very badly. Yeah. So when a child has just been born, within the first 2 or 3 weeks, if they are tested and the virus is found to be active in their body, there is treatment for that. Yeah, but it has very serious side effects, so it's something that doctors are very careful about also. Yeah. So
if you're a mother or expectant, that means, and then you find out you have, that means I would not want to get pregnant again because I'll have to pass it again to my child. Or
it's a chance.
Yeah.
It's not 100%.
Okay.
Yeah, there's a chance that can happen, but there's also a bigger chance that it will not happen. It's 30% chance of you passing it to your child if you've been exposed before. Yeah. So there's a 70% that you will not pass it, or even though you pass it, there's still a very high percentage of chance that they will not be affected in that manner. There are so many kids who are born with CMV, but they are asymptomatic. They don't have any symptoms.
Okay.
Yeah, and they don't get thoroughly affected. But that number that is affected, it can be very severe. Okay. Yeah.
Wow. So what do you think we should do, as a country, to make this whole thing known to people, to create awareness?
The country, we are lacking in awareness. Really, it's every time I talk to a pregnant woman and ask them, has your doctor told you about CMV, about torches? They're not aware. So we have a knowledge gap, and I think even as the First Lady focuses on the Beyond Zero, one of the causes of the high mortality of babies in the first year of their birth is torches. And for me, my case of focus is CMV. So for me, I would plead with her to probably even focus on information. I know most people will say it's expensive to screen for CMV for parents, for someone who is pregnant, but I think prevention is always better than even curing it. So if we can inform mothers, even in public hospitals, we have those posters, about CMV, just so that pregnant women are able to protect themselves. It will go a long way. Yes.
Okay, we'll be taking a short break, but when we come back, we'll be talking more about the CMV. So if you have any feedback or questions, kindly SMS us on our SMS line 20058. Welcome back to Lifestyle with D. We are talking about CMV, a virus that can affect anyone, and we want to create awareness about this virus. And if you have any feedback or questions, kindly send them on our SMS line 20058 and my Twitter handle at Didi Myers. So we are here today with Joyce Wacheke, who have babies have been affected by the virus, and we are trying to get to know more about it. And we've seen. Before we actually even continue, do you know how your twins contracted the virus?
Well, it would be hard to know
Yeah.
because there are two ways to acquire the virus. There's congenital CMV,
Yes.
where a child gets or a baby gets the CMV from their mother before they are born.
Yes.
And the doctors are only able to say that that is the case if the child is tested within 3 weeks
Yes.
after they are born. Now, in my case, my sons were tested after they were 1 year. So really, I cannot know whether it was congenital or it was acquired. Yeah. Acquired is now the way anyone else gets it after now you're born. You can get it from other people through body fluids. Yeah, so we would not really know. Yeah.
Wow, and so you've said when a baby is 3 weeks, they can know.
Yeah, if the baby is born from 0 to 3 weeks, if they are tested, that time the doctors can tell that virus was acquired when they were in the womb.
Okay.
Yeah.
And can they be treated when at that point?
Yeah, after that, at that point, if it's very acute and it's still very active in the body, they can be put on antivirus. Yeah, and that one would help in that, it would reduce the effects, like the extent of maybe hearing loss. Yes. Though for CMV, they say it's progressive, that once your child starts having hearing loss, even though they can hear little, they will progressively lose that hearing to zero. Yeah, so that's the problem with CMV. But at least the other things, like maybe cerebral palsy or any other effect that virus could have, can be mitigated if it's treated at that point. Yeah.
Okay, so if it's congenital CMV, is it more risky for the child?
Yeah, congenital
than the acquired one. Yeah.
Than the acquired one. Yes. Congenital, why it affects the babies more, it's due to the fact that when babies are born, their immunity is very low.
Yes.
Yeah. So then the effect of the virus on the body is greater. Yeah, than for a child who is already grown to be 1 year, 2 years, 3 years, or even a grown up, an adult, who over time you've been exposed to various infections, and so your body the immunity is strong. Yeah.
All right. Now, your twins require treatment. Yeah. Now, how is it going to work? Is it you're working for the ears? So how much is it going to cost?
Okay, because the hearing loss is what they call profound. Yes. It's in the nerves. Hearing aids are not able to help them. Mm-hmm. So what they require is a cochlear implants, and the implants are very costly. Mm-hmm. We've negotiated. At negotiated price, the quotation is that for each year, for each year of a child, it's about 2.75 million. So if you consider that there are 2 children, and both of them have 2 ears, that comes to 11 million shillings. Wow. Yeah, that's how much you need to raise.
Are they getting treatment from here in the country, or?
In the country, the quotation we got was even higher than that.
Really?
Yeah. Yeah, it was coming to 3.5 million per year. So the cost was going to be 14 million. Yeah. Okay. Yeah, it was much higher. Yeah.
All right. And before we ask even people to donate, if I'm a mother or if I want to get pregnant, is it important for me to get tested for CMV?
I think even the most important thing is to have a conversation with your doctor. Mm-hmm. Yeah, you can ask them, because maybe if they're not proactive, you can ask yourself to for the doctor to educate you on torches. And if the doctor, I know in Kenya they test it, they think that it's a high-risk pregnancy. High risk means if you have had miscarriages earlier, or if you have HIV, which means already your immunity is really weakened, they will do torch screening. What happens is that the screening is quite expensive. So for a private hospital, it could go from 20,000 to 40,000 for the screening. And in public hospitals, it's actually not available, really. Yeah. So it's the cost is very prohibitive. Yeah, so prevention is actually a better tool. But when it's already happened that maybe you are exposed, or you think you are exposed, or you don't know that you're exposed and you want to know, you'd have to wait now, because that's a lot of money too. But it's worthwhile. If I had that option, I would have done it. Yeah.
Yeah, because I can imagine I've, say I visit you, or I visit my friend who has a baby, and I'm holding them, I can contract.
Not just your friend who has babies, but I also realize that sometimes even in my grown-up friends, and it's me, I'm taking a soda and someone tells me, I'm so thirsty, I want to sip your soda.
Oh my gosh. Yeah.
So it's not just from the babies, it's even healthy people, adults to adults. Yeah.
Okay.
Yeah, so you get, that's how it is.
Wow.
Yeah.
So I think it's something serious that really needs to be known out there.
Yeah.
And I think there needs to be a lot of awareness created for it.
Yeah.
Probably you can tell us how you've managed to deal with this whole thing. I know you said before, but how have you managed to really deal with it now that how is it? Is your family supporting you? How is it for you?
Me, I've first said that God has been so good to me. I pray a lot, and He's given me so much grace. Sometimes when I look at the things we passed through, I just see the way He has carried us through. And number two, we've gotten a lot of support, and especially myself, from my husband. He's really been there, and he has also walked through the same path. I mean, they're also his kids, it's also been very painful for him. We've had to adjust a lot in terms of life, our lifestyle. We need to pay for therapy for these children, which is not covered by any insurance. We pay for it cash, 3 sessions per week. It is charged per child, not per family, so it's quite expensive. So we had to adjust downwards, and sometimes because of the medical tests, because there's sometimes we are told, we want to keep monitoring their kidney, it's those tests are very expensive. If you have an patient cover, it just gets depleted, and now you have to start paying from your pocket. So we've gotten a lot of support also from friends. Yeah, the people who've been there really standing with us, and we are so grateful, even for the encouragement. Yeah.
All right, so according to research, only 13% of women know about CMV in the United States, that is. And I'm thinking probably in Kenya it's less.
Definitely.
Yeah. Definitely. So as we wrap up the show, you could probably just tell us, what really needs to be done, what a woman can do to also prevent herself from that, and of course the potential mother, so that they also don't pass it to the babies. And also if I visit a friend, I shouldn't, something I can do not to prevent these cases. Yeah.
Well, for grown-ups, this affects even grown-ups more than just, grown-up to grown-up, not just that, you're a small child versus versus a mother, that we also have this tendency of sharing things a lot. Yeah. So we share sodas, and you're using the same straw, it's just being friendly. But especially if you're pregnant, we're talking about 2 lives there. So it's good to be very mindful of your unborn baby, because there's nothing that I think hurts more than looking at your baby go through some things, and you know it was possible to prevent it. You are just not educated, or you didn't know how to. But it's even worse now if that happens when you have already had this information. Yeah, so let's put it in, let's put it in our minds. Let's share out there. It's important that women just get informed about this, especially those women who are planning to get pregnant or they're already pregnant. Yeah, and share it everywhere. If you have forums where you're meeting in chamas with other women, share. Let this be a conversation that is common. Yeah, and I think that will go a long way in just preventing the damage that this thing does to families and to children.
All right.
Yes.
So we've come to the end of the show, but we'd like you to actually, because we want people to help with the funds, that is the 11 million that is needed to treat your twins. Yeah. Because of course, at the end of the day, we want them to get cured, and get better. Yeah. So would you mind sharing your number or the pay bill number that they can send to? Yeah.
Thank you.
Yeah.
At the end of the day, for every parent, you want your child to have the best out of this life. There are many labels to children who have gone through CMV, special children, disabled children, but you want to give your child a chance to go to a normal school, to have a normal life. So that's why we want to do the hearing intervention for them. We are planning to do a fundraising on the 28th of this month in Mombasa. But the meantime, for those people who are not there, it will be at Mbaraki Sports Club, 6 p.m. But for those who are not there or who are not able to come, they can send their contributions through pay bill number 523206 or M-Pesa 0721 606693. Yes, thank you.
The pay bill number again is
523206.
523.
Yeah, the account is Matthew and Michael Medical Fund, and for the account name, someone can just put their name.
All right.
Yeah.
Okay.
Yeah.
So, of course, if you want to help, and it's very good to help, at least helping children so that they can become better for a better future, and also be aware of CMV as a mother and as a potential mother. And if you have friends, of course, you can share this information with them so that they can be aware that CMV is real and it's happening to people. But because of the rare symptoms that we get to see, that we don't get to see, that means not many people know about it. And also many pediatricians don't talk about it, and doctors, they don't talk about it. So kindly share this information. This has been Lifestyle with Dee. Thank you so much for joining us. Always keep yourself tuned to this program.